Bernie and Biden had a heated back and forth here. They really went in on the issue of healthcare. This got testy. This got interesting. And I have a lot to say about it.
Vice President Biden, I'd like to bring you in. You spent an awful lot of time 10 years ago trying to pass a bill far less ambitious than what Senator Sanders is talking about here. Is he being realistic?
I don't think it is realistic. Let me explain why. I introduced a plan to build on Obamacare. Remind everybody, 20 million people got insurance, didn't have it before. All people with pre-existing conditions are able to be covered. I could go on. We didn't get all that we wanted. But now that it's been exposed, that taking it away has such dire consequences, I've added to the Obamacare plan the Biden initiative, which is a public option, Medicare, if you want to have Medicare, for reducing significantly the price of drugs, deductibles, et cetera, by underwriting the plan to a tune of about $750 billion, and making sure that we're able to cover everyone who is in fact able to be covered. Put your hand down for a second, Bernie, okay?
Just waving to you, Joe.
I know.
Say hello.
I know. So look, it covers everybody, it's realistic, and most importantly, it lets you choose what you want. Here, you have 160 million people who negotiated their health care plans with their employer, like many of you have. You may or may not like it. If you don't like it, you can move into the public option that I propose in my plan. But if you like it, you shouldn't have Washington dictating to you. You cannot keep the plan you have.
Thank you, Vice President Biden. Senator Sanders, 45 seconds to respond.
Under Joe's plan, essentially, we retain the status quo.
That's not true.
No, it is exactly true. Thank you. And by the way, Joe, under your plan, you asked me how we're going to pay for it. Under your plan, I'll tell you how we're paying for it right now. The average worker in America, their family makes $60,000 a year. That family is now paying $12,000 a year for health care, 20% of their income. Under Medicare for All, that family will be paying $1,200 a year because we're eliminating the profiteering of the drug companies and the insurance companies and ending this Byzantine and complex administration of thousands of separate health care plans.
Senator Klobuchar, I'm going to come to you.
My name was mentioned.
Yes, I'm going to come to you, but 45 seconds. 45 seconds for Vice President Biden.
It's not interrupted here, all right? I'm going to interrupt now. It costs $30 trillion. Let's get that straight. $30 trillion over 10 years. Some say it costs $20 trillion. Some say it costs $40. The idea that you're going to be able to save that person making $60,000 a year on Medicare for All is absolutely preposterous. 16% of the American public is on Medicare now, and everybody has a tax taken out of their paycheck now. Tell me, you're going to add 84% more, and there's not going to be higher taxes? At least before he was honest about it.
Oh, Joe.
It's going to increase personal taxes. They're going to be...
That's right. We are going to increase personal taxes. Okay. But we're eliminating premiums. We're eliminating co-payments. We're eliminating deductibles. We're eliminating all out-of-pocket expenses. And no family in America will spend more than $200 a year on prescription drugs.
Senator Klobuchar.
Our plan will save the average worker far more.
Senator Klobuchar, we'd like to hear from you.
Senator Klobuchar, pay premiums or payments.
Just so everybody knows, at least at this point right now, it's increasingly coming down to Biden versus Bernie in the polls. It's looking like it might be a two-person race flat out very shortly. There's some people in striking distance enough to make a move at it, like maybe barely hanging on is Warren and Buttigieg, but right now it's Bernie and Biden's kind of separating themselves. So you're looking at really the heart of the debate here for the primary. And, oh man, it's amazing how wrong one of them is. So let's go through this. Biden was asked the question, and thank you, PBS, for, the same question that's been asked about 17,000 times and has been adequately answered 17,000 times, but people still act like it's an open question. Biden's asked, is Bernie's plan realistic? See, this is what frustrates me, guys, is that it's not, like, I can stomach ideological disagreements, but I can't stomach either lies or just things that are so objectively wrong that are casually thrown around. either like the deepest ignorance ever or lies. I don't know which it is, but either way, I can't stand it, because if you're asked the question, is it realistic? You have to factor in that every other developed country has universal health care, one version or another of it. And they don't do that. And so they just go, no, it's not realistic. But you're so mind-numbingly wrong that it's embarrassing, that if you show this video to somebody living in any other developed country, they'll be like, wow, I can't believe you just said that. Really? It's not realistic? Of course it's realistic. Of course you could do it. It's just a matter of actually doing it. But you have to take on powerful special interests. You have to take on Big Pharma and the for-profit health insurance companies, and a guy like Biden's just not up to that. Keep it real. He's just not. Those are his donors. So then it got testy when he was like, put your hand down for a second, Bernie. Yeah, dude, the reason his hand's up is because you're lying on his plan. Like, you're repeatedly saying things that are not true. I'll be kind and say, I don't know if it's a lie, but you're saying things that are just not true about his plan. Of course he's going to put his hand up. Of course he wants to correct the record. It's like you're grossly smearing his ideology and his proposal, and then you're upset that he's like, I want to talk about this. It's unbelievable. Then he goes on to make the choice point. You know, I'm amazed, guys. I'm amazed that at this late date, they still haven't, like, you have to adjust your propaganda. You can't just keep using the same points that have been debunked 1,000 times. So when we talk about choice, I just told you, we have less choice under our current system with our private health insurance companies running the show. I know, because first of all, you have to get like a new plan every year, which is just so frustrating and annoying that you have to go through the same all the paperwork and nonsense every year. But I can't even choose my doctor, because every plan that I pick, have a choice, has in-network doctors and out-of-network doctors. So they limit my choice. And the idea that like, oh, but I will give you a choice as to what's covered and what's not covered. But I want everything covered. How ridiculous is that? That's like with fire insurance, where you say, I only want my bedroom and the kitchen covered, but if my living room burns, leave it. I want the choice. Is that an area where choice makes sense? Is that an area where choice is reasonable? No, I think that's absolutely ridiculous. I think that that's something that should just be off the table. I don't need choice in what's covered. I want everything covered. Full stop. Every plan should be the gold plan. Full stop. So when he brings up choice, okay, under Medicare for All, you can go to any doctor you want to go to. Under our current system, you can't. So tell me who has more choice again? That's right. It's Medicare for All. But then he's like a choice of keeping your current employer health care. And he usually brings up the unions. He didn't hear, but he usually brings up the unions. He says, oh, well, they fought hard for their health insurance plans. Yeah, but a lot of unions have already endorsed Medicare for All. So you're willing to accept their argument when it was like, oh, you fought for your health care plans, but you're not willing to accept it when they say, oh, yeah, and we also support Medicare for All. He conveniently leaves that part out. But a lot of them do support Medicare for All. And by the way, all we're talking about is let's have them have everything covered and pay less. So yeah, they fought for better insurance plans, but why shouldn't everybody have a top-level insurance plan? Who would you deny good insurance to? I know my answer. Nobody. What's your answer, Joe? So the choice thing is nonsense. Now, Bernie's response, man. Bernie's response. He says, listen, under our current system, average family makes $60,000. They pay $12,000 for healthcare, for health insurance. Under Medicare for All, they'd pay $1,200. Why? We're getting rid of the greed and profiteering, the unnecessary price gouging middleman. I would love it if Bernie, for once, took my point on this and started calling the for-profit health insurance companies what they are. A mafia. They're an unnecessary middleman. They're taking their cut. Why should they even be in the middle? If we have a single payer, a single insurer, the government, they don't need to take a cut. They don't need to take a cut. So, I'd love it if he pointed that out. But he brings up the raw numbers. And Biden's got no good response to it, which leads to the final point, which is Biden gets loud, which, by the way, doesn't mean you're right. It just means you're loud. Go ask Bill O'Reilly if being loud means being right, because that was his trick throughout his whole career. I'm going to be really loud. That means I'm right. He said, it costs $30 trillion. I love it when they bring up the whole price tag. And, by the way, totally just missed the point that Bernie just made, where he's like, yeah, Medicare for All is less expensive. What are you missing here? What are you missing? But he goes right back to $30 trillion it costs. I covered the detailed study on this show from the University of Massachusetts Amherst, I covered it. Medicare for All saves $5 trillion over the course of a decade. $5 trillion. Even if you take the libertarian Mercatus Koch-funded study, it saves $2 trillion. So any way you slice it or dice it, it saves money. So don't bring up the price tag and be like, oh my God, the price tag, because then we can flip that right back on you and then some. What about the price tag of what we have now? Really, we can't afford to not do Medicare for all. That's the reality. And the worst point he made, again, don't know if it's dishonest or if he's just ignorant, but he says, oh, you're going to add 84% on top of what we're paying now. This is the old Hillary trick. And there were hack smear articles written against Bernie, I believe in the Washington Post in 2016, where they did this same trick. Guys, they take the cost of Medicare for all, and then they add it on top of what our current healthcare system is. It's hard for me to think that that has any chance of not being dishonest and a lie on purpose. Because everybody knows that when you're talking about Medicare for all, it replaces our system. It replaces it. So for you to bring it up as if it makes sense for the numbers to just add it on top of our current system, that's ridiculous. Because as Bernie rightly points out, we're eliminating premiums, copays, and deductibles. We're getting rid of the for-profit health insurance companies from being the core and the backbone of the system. We think they're the problem. So for you to say, add 84% on top of what we're already paying, I mean, that has to be dishonest. Because you know that he's not talking about adding a system on top of our system so we have two healthcare systems. He's talking about fixing the healthcare system we have, getting rid of the trash one, and bringing in the new one, the better one. So, but that's all they have, and that's why I'm so frustrated is it would be nice to see a debate between somebody who actually believes in a market healthcare system, but can not make just objectively shitty, debunked 1,000 times talking points. So, to me, that's far and away, Bernie destroyed him, but it really is something to watch Joe Biden get testy, especially when he's dead wrong about something and he gets really condescending and loud. Pipe down with your terrible corporate talking points that have been absolutely obliterated 1,000 times over, man. I mean, this really grates on the nerves.